We're live, and welcome to day 5 of Naturopathic Medicine Week, and of course, ad hoc with the doc. Today, we have 5 doctors from Naturopathic Specialists, and we're here once again to celebrate Naturopathic Medicine Week. We've been in the community this past week for the last 4 days. On Monday, we visited with our affiliates Soul Sports Scottsdale Running Zone. On Tuesday, we were at the Joy Bus Diner with Jennifer Caraway and her foundation Joy Bus, which supports people with cancer that are homebound. On Wednesday, we were in Flagstaff at Winter Sun with Dr. Amber Belt, our partner in Flagstaff. And yesterday, we were at Natural Partners Incorporated, who's been fantastically supportive to naturopathic medicine over all these years. And they also were the winner of the AANP Corporation of the Year. And today, our very special edition of Ad Hoc with the Doc is to sit together as a panel of physicians. We all practice together at Naturopathic Specialists, starting from the end. Who's no stranger to Ad Hoc with the Doc is Dr. Jessica Stefanski, and then of course Dr. Melissa Coates, Dr. Amy Waite, and a brand new addition to the team, starting in 3 days.
3 days.
And
On
who was
Monday.
just licensed yesterday, Dr. Adam Kozin, and of course myself, Dr. Dan Rubin. As always, we encourage you, the audience, to write in and ask us questions. Today, there's no specific topic. It's about naturopathic medicine. Go ahead and submit something via Facebook, and we'll do our best to answer your question. In the meantime, we do have some FAQs that we want to talk about, and we'll get to those pretty soon. But first, what I'd really like to know is, Dr. Stefanski, you came to Arizona about 1.5 years ago, and you were practicing where?
In Portland, Oregon.
And there's what I've seen, and what a lot of doctors talk about, is geographical differences in the way medicine is practiced, whether it be based on the type of clientele or patient load. Have you seen any differences in the approach people have to naturopathic medicine since you moved here as compared to your Portland practice?
That's a good question. I think there's definitely a different level of awareness of naturopathic functional approaches. I actually think it was a little bit higher in the Northwest.
Which makes sense because the school's been around longer.
Yes,
They're National College. Where did you graduate from? Which school?
Yeah, so it's National University of Natural Medicine.
Okay.
And the oldest school of naturopathic medicine in North America.
When did you graduate?
2014.
Excellent. And your interest in women's medicine was from the get-go?
Yes.
Or was it before you entered medicine?
Before, always, since I was a kid. So, I had originally planned on going to conventional medical school. I was pre-med in college, did some work with some doctors, and, had my own health challenges growing up, and just never really felt like the conventional medical system helped me very much, and just got a little bit disillusioned through the process, so decided to kind of put my medical dreams on hold. I'd never heard of naturopathic medicine before, and then I worked in business, I did a lot of public health work, and was on a trip out to Seattle and read an article about naturopathic medicine, and it was a light bulb moment for me. So
wonderful. And Dr. Kozin, you recent graduate, just getting licensed right now, basically as we speak. I think the board met yesterday. You're about to enter into your residency into practice. Since you're our most recent grad out of all of us, and you were in school for how many years? Naturopathic medicine? 4-year curriculum at Southwest College. What changes did you see in those 4 years? I'm very curious, trying to assess sort of the robustness with which naturopathic medicine is moving forward from when you got into sort of where you are now, knowing that you were an early student to a later student, and your sophistication has matured.
I'd say the mind share and the market share of naturopathic medicine is significantly increased. It goes hand in hand with other movements in health, and I think there's a decentralization of healthcare happening right now. And so for my first year, it was kind of, we're all new to this, and you don't see a lot of Facebook stuff on it, you don't see a lot of conferences, but nowadays you see like the Bulletproof conference is going on right now, and there's NDs speaking at that conference, whereas a few years ago I don't think there were NDs there. And So you see naturopathic doctors really branching out and speaking at all these summits and all these conferences. So I think it's,
Excellent.
The market share and people really are getting to hear about naturopathic medicine.
What do you mean by decentralization of healthcare? That's an interesting concept.
Whereas, you'd normally just go to see your doctor that your insurance tells you to go see. I'm Canadian, so this is, a little,
Sure.
but people are becoming a lot more aware now with the internet, and they kind of can go do their own research, and they kind of know what they want, and they're coming to their doctors with questions, and if their doctor isn't satisfying them, they'll go out and seek other practitioners. And so I think the internet has really decentralized healthcare, taken away the traditional healthcare model of going to see your doctor that you're told to, and that what you do what they say, and now it's like, I don't agree with that, or I'm looking for this, and then you kind of search for that and find it yourself. So now there's all these different avenues of healthcare opening up to patients.
Excellent. Do you think that causes confusion in the marketplace for consumers? Because not everybody is a savvy healthcare consumer.
I think it does, definitely. There's pros and cons to that system as well. You can get preyed upon, but I think it also lets the best of the best shine as well, and it can really provide a benefit to patients' healthcare.
Well, Dr. Coates, you graduated 10 years ago, correct?
2008.
And we've been practicing together for about 10 years. So coming up on 10 years, and based on this decentralization concept that Dr. Kozin brought up, and the fact that it may confuse the public, where do you see naturopathic medicine, now that you've sort of seen it for 10 years, where do you see it, or market share that it has or can go get? It's very important to not confuse people, because it could be very damaging to people. You see naturopathic medicine having the ability to gain more market share, to attract more consumers?
Yeah, definitely. I would say that they've definitely gained speed, and there's a lot more people that are aware of the benefits of our medicine, and even combining it with their conventional care too, and that they don't necessarily have to choose one or the other, which I think is also of value.
Integrative care.
Integrative care, essentially.
And so are you seeing more and more people that are integrating versus choosing one or the other now?
I would say yes, especially in the world of oncology, and it seems like patients are more aware of the benefits of it, and that they really see a better outcome, and even the doctors are also. On the conventional side, they realize that we have a lot to offer their patients alongside what they're doing, and it's better for everyone because they have both sides helping them.
And you've seen, I assume, more acceptance throughout the conventional medical world of these co-management and aspects, and I think it's largely in part to the ability to integrate in the greater medical community, in my opinion, appears to be dependent on the ability for the doctor to really integrate and to speak the language of where they're trying to integrate. Does that seem true?
Yeah, and I think that that's something that is great, is that our education, they don't realize how much education we really have. I mean, we do 4 years just like everybody else, and beyond the regular didactic track that traditional medical students go through, which we do. We learn all the physiology, biology, everything that they do. We are also learning the naturopathic tools, which I think is amazing that we can pack all that into 4 years. It's a lot of education, and I think that once MDs realize that, and that we're going to the same conferences, we're doing the same amount of continuing education, if not more sometimes, and they realize we're at a level that...
It's a great point. Let's prove the point, okay? Because Michael found statistics today, and let's talk about if we were to compare naturopathic colleges to some of the conventional medical schools out there. I won't use names, but these are reputable schools, both on the naturopathic side and the allopathic side. There are some non-credited schools that they've quoted here. As a consumer, watch out. If you're looking to consume naturopathic medicine, make sure that the doctor or the practitioner that you're looking at or going to has graduated from a university or an accredited, federally accredited naturopathic medical school, or one that is eligible for accreditation. Not an online school that they call themselves or they call themselves naturopathic doctors or naturopaths, but they're not naturopathic physicians. And there are those out there. And in fact, their training is not the type of training that we have. They're not licensable in states that have licensing bodies like here. So just be careful. I wanted to say that if you're a consumer out there, or if you're looking to start seeing a naturopathic doctor, let's just look at this. In basic and clinical sciences, there's up to 1,639 hours in the naturopathic side of things. And on the conventional side of things, there's up to 1,771 hours. So there's less than, there's about 140 more hours on maximum to maximum. Very close in the basic sciences. Sometimes naturopathic medicine is more, sometimes the conventional schools are more in this, depending on which school you're looking at. In terms of clerkships in allopathic therapeutics, we come pretty close, but there's some disparity between 100 and 300 hours of allopathic therapeutics. We have up to 2,244 hours, whereas there's up to 3,391. But there's a medical school that's just under 100 hours less than the naturopathic medical training. In terms of, this is interesting, in terms of therapeutic nutrition, which is a huge thing. We're going to talk about this today. Dr. Wade, I'm going to ask you some questions about nutrition because you are very astute on food and dining and you help so many people. But this is an astounding statistic, yet not surprising. I don't think any of us will be surprised. That out of the two naturopathic medical schools, one has 144 hours, another has 132 hours of therapeutic nutrition courses. Out of 3 allopathic schools, all 3 of them have this many, 0. There was none that were showing up. So we truly, truly are not only physicians, but we're experts in nutrition, eating food. Everybody does it every day so they can live. You can't not eat. Obviously there's fasting, but we're talking about in general. So it must play a role in human health. Give us a few minutes on what you've seen, especially because this month is National Obesity Awareness Month, and we know the statistics are out. Just about 40% of adult Americans are considered obese, and about 19% of our youth are considered obese. And it hasn't gotten any better since the effort started in 1999. It's a concern. You do a lot of weight loss management for your patients in your practice. Have you seen any trending so far in the last, say, 3 or 4 years? Any more people coming to see you? The ability of good quality food, is it easier to get nowadays, or is it not as easy to get? Are there changes in some of the fast food restaurants' offerings? What are you seeing out there?
I've seen a lot of changes. I had food allergies 12 years ago. I started feeling symptoms of gluten and dairy intolerance, and trying to find a gluten-free bread 12 years ago was really difficult. Now there's so many gluten-free options. So just, I mean, in the last 12 years, there's dairy-free, gluten-free everywhere. So for that, it's made life a lot easier for me and for my patients that have the same intolerances.
And you've seen people, if you take them off dairy or gluten, that they can sometimes optimize their weight, or at least that's part of it, maybe, of the weight optimization protocol?
Yes, decreasing inflammation in the intestinal lining allows them to absorb proper nutrients. Proper nutrients are needed for optimal metabolism, thyroid function, all of these different things that we need. We need nutrients to lose weight. So if you aren't getting...
We need nutrients, so we have to eat food to lose weight.
Nutrient-rich food.
That's an important concept.
Anti-inflammatory food.
Okay.
So
what's the difference between, what's an example of an inflammatory food and an anti-inflammatory food?
So we all know sugar, probably. Hopefully the viewers know that sugar is inflammatory. But some patients react to things like dairy, and it causes a lot of inflammation in their body. We have specialty testing that we can do to look for those things. Every patient's different in how they react to food, and so luckily we have those tests available that we can look to see how they're responding.
Wonderful. Dr. Stefanski, in your practice, you practice something very unique. Tell us a little bit about your Mayan abdominal work or your pelvic techniques. It's unique. I don't know any other naturopathic physicians doing it, but tell the audience a little bit about that and what it helps and what it's good for.
Yeah, so I think one thing that when you're in practice and, you're like, for me, I'm optimizing hormones and, helping people with inflammation and all these things, but sometimes we need to actually have a hands-on therapy for our patients. So, for example, people who are having chronic digestive issues, IBS, SIBO, small intestinal bacterial overgrowth, they often have not only issues inside the gut, like in terms of the nervous system and things like that, but they actually have physical problems with the organs being able to move properly. They may have scar tissue.
Okay.
Women who have endometriosis or who have, there's some other conditions that can cause actual obstructions, adhesions,
So
scar tissue.
The organs need to move inside the body?
They need to move. So every organ has mobility and motility. So you think about the stomach through the process of digestion, it's moving, right? And then it has, then it sort of has an axis that it moves around just every, couple seconds. So every organ is like that. So every organ in your body. It moves
things through, but it also has to move itself.
It also has a natural movement. Yeah.
It's an important concept.
So I've been trained in a couple things, Baral visceral manipulation, something called holistic pelvic care, which I learned with Tammy Kent, who's a physical therapist up in Portland, really amazing, the author of Wild Feminine. And then the Mayan abdominal therapy. So usually what I'm doing with the hands-on work is I'm combining them as part of a
taking things by mouth
protocol.
Only goes so far. Sometimes you need an actual physical type therapy.
Yeah, and then also the pelvic floor is a big issue for a lot of women. So women who've had trauma, so things like childbirth or like a fall, or you have hormone issues, or you have things like sexual abuse, or that kind of center themselves in the pelvis. And so sometimes it's good to do some hands-on therapy with those women in addition to the other therapies that we do.
I think it's wonderful. I've referred several people to you. I know your very, very types of acupuncture techniques are wonderful. I just think it's so important, like Dr. Stefanski said, not to overlook not just a mechanical type therapy, but the doctor-patient interaction, not just across the desk, but the energetics and the notion, humans, there's therapeutic touch involved, and it's so important. And I think as medicine becomes more modernized, there's less and less physical examination. Now we have machines that can look inside that are better than the palpatory skills of a physician. Even if you're putting a stethoscope on somebody, you still have something in between your hands and the patient. Laboratory tests, it's an issue. And I'm really happy and thankful that you brought that to this clinic, because I know our patients are better off for it. Dr. Coates, I believe that this not only is National Obesity Awareness Month, sorry, but it's National Mental Health Awareness Month too. You see quite a few people with diagnoses related to mental health or mental wellness. Have you seen an upturn in certain diagnoses or diagnostic codes or uses of medications? Have you seen more and more people having their psyche medicated, if you will? And if so, have you seen any problems associated with that?
Yeah, unfortunately, everyone, it seems like these days, is on an anxiety or depressive medication of some sort. Even young people are coming in on them, and because instead of dealing with whatever issue it is, and it could even be their diet that's creating issues, they just give them a pill and want to fix it.
Wait, are patients more apt to just take a pill because they think it's a quick fix and they'll go on with their day?
They'll start that way, but then they quickly realize that isn't the answer, and it has more side effects that are not doing any good for them. And a lot of those medications are short-lived in their action, and after a while they quit working. If you're on them for a number of years, they don't work anymore, and you're either addicted and can't get off of them, or you feel like you're in a vicious circle where you're not getting anywhere.
Go ahead, sorry.
So we have a lot of naturopathic things we can do. And one of the big things I like to do is neurotransmitter testing to actually find out what the brain is asking for, and so you don't have to guess and keep trying different medications or even supplements for that matter.
How do you do that type of testing?
It's actually a urine metabolite test, so it's very simple, and if you're afraid of needles, it doesn't involve any needles, which is nice, and that's why we can do it on children too.
So you can see what happens or going on in the brain by assessing the person's bodily fluid as urine.
yes, it gets sent off to a lab where they look at the urinary metabolites and they can see serotonin or epinephrine, GABA, other
So
things
maybe
like that.
ADHD or obsessive compulsive or anxiety or depression, you can actually see potential indicators of these and then help people either get off their medications or not need medications if they're not medicated.
Yeah, we typically use amino acids to help wean them off their medication, or if we see that the medication is still maybe necessary, but maybe they need a different medication that isn't covering the areas. Like an SSRI, for example, just covers serotonin, but some people need an SNRI where it's serotonin or epinephrine, or they need amino acids to help balance that out, or it's not covering GABA, or you never know. And it could be that sleep is the issue, and that because they haven't been sleeping for so long, and other things like that. So we're able to get that picture
Do you
going.
see a lot of impact? You do a lot of work with people with cancer. You and I have worked together, like I said, for almost a decade now. Do you see an intersection of the mental state of people or their mental health and oncology?
Definitely.
Cancer care?
It's a loss, to lose control of your health and have something out of control in your body that you didn't foresee happening. So that's definitely a conversation I like to have with patients about, how are you really doing? How is your family handling this? Do you guys need help with that? Do you need referral to a counselor? Do you need homeopathy or whatever it is, that acupuncture to help with the anxiety? It's definitely a conversation I like to have for them and their caregiver.
Important point, because you developed a really interesting program here at NS about caring for the caregiver. You spoke about it at our national conference about 3 years ago, the Oncology Association of Naturopathic Physicians. Talk about the importance of the caregiver. They get fatigued. I mean, they're caring for themselves, their family, the sick person.
Yes, the statistics on caregiving is actually worse than sometimes what the patient is dealing with. It shows that a lot of them end up with chronic disease and actually worse diagnoses. Anxiety, depression, heart disease, all kinds of things happen when you're a caregiver. So it's really important that when someone brings their caregiver with them, especially, I also look them in the eye and I say, how are you doing? And we developed a caregiver coupon so that they could have a visit on their own, as well as a massage and some other things to help care for them, which is
Here
really
at the clinic.
Here at the clinic.
That's a program that Naturopathic Specialists has. It's called Caring for the Caregiver.
The caregiver coupon,
Caregiver
essentially.
Coupon. And there was a whole handbook. I mean, it's really, it's a truism, and it's really very important, I think, overlooked in a lot of institutions about caring for the caregiver. So.
Yeah, they're sitting a lot of times out in waiting rooms for hours, and they could be getting care during that time, so we find value in that. And also it makes the patient feel better knowing that their loved one is not being stressed out so much too, because they feed off of that energy and they need to both be in a good space. So,
Dr. Waite, very important concept. You lectured about it a few months ago at the AZNMA, or our state symposium. It was about the treatment of men with low testosterone without using testosterone injections necessarily. We did an ad hoc about it. I don't know how many people saw it, but it's such an incredibly important concept that if you could say a few words about that to our audience, potentially you could save people a lot of ill side effects down the way as they go. Tell us a little bit about your philosophy, the program, what you see about maybe toxins in the environment, and just a couple minutes on how you approach sometimes a man with low testosterone.
So the first question about low testosterone, as I started shadowing a lot of men's health doctors, I just saw prescriptions of testosterone. That was basically the treatment that they were giving everybody. I saw elevated blood levels that were in the dangerous levels, thick blood that wasn't being monitored. Patients, increase the risk of heart attack. I just saw a lot of dangers associated, and I found a way to raise testosterone naturally, which has been working very well for me. What goes hand in hand in that is lowering, decreasing the amount of environmental toxins that my patients are exposed to, teaching them about the certain environmental toxins that will increase their estrogen levels and decrease their testosterone levels. So
Wait, do they actually or do they mimic our internal hormones?
They mimic, so there's something called xenoestrogens or synthetic estrogens that are found all around us.
And we're in Maricopa County, folks. Maricopa County has pretty high levels of certain petrochemicals I've seen, because we measured them and we've seen the statistics. So I just wanted to kind of state that everybody out here, you can look at the statistics for your county, but here we have a lot of these xeno or foreign estrogens. Sorry to interrupt, but I wanted to say
No, we do, and they're relatively easy to avoid for the most part, at least avoiding a high percentage of them if you are educated. So that's something that naturopathic medical doctors do. We spend a lot of our time educating our patients so they know what to stay away from and know what foods to eat, what foods not to eat, what chemicals to stay away from in their home, etc.
And so by taking them through a lifestyle program, you can help remove the stuff that may cause the abnormality on lab, which may be masking what's truly happening in the body, when some clinics may just jab them with some testosterone and keep them on that, which could cause
low sperm count too.
Which
And
could
we
be a
talked
problem. Yes.
we talked about that.
Yes.
Sperm counts had decreased by 57%. If that was happening in the animal kingdom, those animals would be maybe on the extinct list. I mean, humans might be
Sounds like
extinct if this continues.
I
But
digress.
so avoiding a lot of these chemicals too will increase sperm count. Avoiding exogenous testosterone or testosterone injections will raise sperm count as well.
Dr. Kozin, what are you most excited about becoming a physician and entering the world of clinical practice?
Oh boy.
Yeah, just think about it. Let our audience know.
Besides working with
This is a
us.
Working with these
Yeah.
lovely people, helping people. I mean, you go through 4 years of school, and I mean, this is a goal I've wanted to achieve my whole life, and just help people. That's what I'm most excited about, reaching the most people I can and helping the most people I can. And with everyone's help here, I think that I'm in the best place to achieve that.
This has been wonderful. It's truly a pleasure to work with you guys. Missing today, Dr. Walter Trinian, Dr. Lisa Elschuler, and my wife, Dr. Debbie Smolinski. They couldn't be on the panel today, but we're the physicians and naturopathic specialists, +3. As always, it's been wonderful to be here with Ad Hoc with the Doc, and look forward to seeing you here, hearing from you.